Mga kaibigan, muli ho nagbabalikan yung programa Action Central Luzon Special Edition. Ito pa rin po si Sunny Lopez, kasama ko po si Dr. Rafael Lizing, a urologist based in Central Luzon. No? At pinag-uusapan po natin erectile dysfunction. At yung first base pa na pag-usapan na natin at gusto ko pong ipagpatuloy namin yung tungkol po kung paano mag-approach ang isang pasyente na hindi dapat nahihiya sabihin yung kanyang problema sa kanyang doktor. Kasi sa treatment, importante rin yung sinasabi nila kung anong problema, di ba, Doc?
Yes, tsaka based on the history, dun kami our management would matter on the history of the patient, actually. Isa pa rin siguro magandang pag-usapan natin, Sir Sunny, yung about their ongoing medical problems.
Okay.
Because...
sabi mo kanina yung diabetes, di ba?
Yes.
Nakaka-apekto yan. Ano pa mga sakit na pwedeng...
First and foremost, pag diabetic ka, you have to have a good control of your diabetes.
Okay.
Okay? It's very unfortunate minsan, darating yung patient sa'yo with ED, the problem is yung nag-sets in po na po yung neuropathy, nandun na yun.
Yung pagkasira ng mga nerve.
Yes. Minsan, hirap na kami. Okay? Aside dun sa diabetes, yung minsan, these patients are taking anti-hypertensive drugs.
Yung pampasataas ng presyon.
Yes, we have anti-hypertensive drugs that are notorious causing erectile dysfunction.
Okay.
Okay? The non-selective beta blockers, for example, okay? They like propranolol, pati yung isang type of beta cells ng cavernous muscle na na-block niya. So, nagiging increase yung tone ng muscle na yun.
Okay.
Ng blood vessel na yun, I mean. So, in the end, hindi niya rin ma-achieve yung
gusto niyang...
tumescence.
Okay.
Ano pa po yung ibang drugs na nakakapag-cause ng...
ano pa ba yan?
Like diuretics, Sir Sandy, diuretics.
Di ba sa presyon din natin?
Presyon din yan. Okay?
Bakit? Bakit naman yan?
Parang ganun din, Sir Sunny.
Okay.
Tapos may effect din sila sa brain. Dinidecrease niyo yung libido ng pasyente.
Yung pasyente.
Yes.
Okay.
Isa pa rin yung first generation na H2 blocker, like cimetidine.
Okay.
Kakukos din ng
ano yan?
Erectile dysfunction.
Okay.
Yan.
So, yun lang.
Yes,
Ano,
yes.
ano pang sakit naman? Yun, puro sa presyon yung pinag-usapan natin yun.
Actually...
so, yung diabetes, tapos yung hypertension, yung medication.
Yeah, actually, hypertension itself would cause erectile dysfunction somehow kasi nga it's a cardiovascular disease.
Yes.
So, involved na rin yung mga blood vessel dyan. Okay?
Circulation, di ba?
Yeah, circulation. Patients taking anti-psychotic drugs, antidepressant drugs, they can cause erectile dysfunction.
Okay.
And then patients taking in, of course, self-explanatory to, yung mga anti-cancer drugs, they also can cause erectile
Pero
dysfunction.
what do you choose? Siyempre, you have to make a choice. Is it your sex life or your life? Mga ganon.
Things like
Kunwari,
that.
kailangan
Although,
man tigilan yung mga gamot na tinitake mo o tungkol sa yung kunwari sa presyon, sa...
in the field of hypertension, Sir Sunny, actually,
Or do you
you
have-
can modify that.
Okay.
We have a lot of newer drugs for the hypertension. Although in fairness
na
sa mga...
sinasagot yung problema yan.
Yeah, although in fairness
Addressing
sa
that
mga...
problem, ha?
Yeah. Although in fairness sa mga internists natin, mga cardiologists and all, meron silang kanya-kanyang choice for that particular disease eh. So minsan kailangan talaga to, like beta
walang
blocker
choice,
for this
right?
particular guy, for this
right.
particular patient. Nowadays, like this angiotensin 2 receptor inhibitors, yung mga losartan,
Right.
irbesartan, candesartan,
Yes.
they are good for they cannot cause erectile dysfunction.
Erectile dysfunction.
Same true with other antihypertensive.
Pwede bang kausapin mo rin yung kunwari yung cardiologist mo?
I did that actually.
Doc, ayaw kong
I did that actually once in veterans. When I was in training, I called up his doctor because this particular patient is so parang matanong siya, insistent siya. So, okay, let's call your doctor. Kinol namin siya, I'm going to change the medication of your patient. Well, what would that be? Anong gusto mo? I'm planning to change it to, let's say, losartan, potassium, or something like that. Sabi niya, Doc, actually you can. After a couple of
So yung
days,
urologist and the cardiologist, they can work together.
Yes.
Para dun sa pasyente, no?
Actually, that's the ideal multidisciplinary approach.
Tama, no? Hindi lang yung isang, ano,
Yes.
no? Okay, sige, Doc. So, yun na yung mga sinasabi mong nakakapekto.
Yeah.
So, ano naman yung mga gamot na, alam mo na, yung ngayon, di ba, mga uso-uso
Well,
na para nang sa
we are
ngayon.
so fortunate. More than 10 years back, naka-invent sila ng mga drugs. Before kasi, Sir Sunny, a little highlights lang. Before, ang mga medications to harden the penis, intracarvernosal injection lang.
Yung injection, gano'n?
Yes. In order for you to have that activity, you have to submit yourself to this kind of parang
Injection ka pa, ha?
may injection ka pa.
Sakit
You would,
ata nun, di ba?
you
Sabi
would
mo
experience
nga.
pain, parang ganun, just to achieve this intercourse or ano. Of course,
Magastos pa
dito pumapasok ang importansya sa relationship. Parang you are ready to face this kind of painful procedure just to have this activity. Now, we are so fortunate, we have now these drugs, this sildenafil, tadalafil, this vardenafil, they are all phosphodiesterase 5 inhibitors.
Commonly, ano yung mga, para hindi naman tayo nag-advertise.
Yeah. Okay. Zilden. Sa sildenafil, Zilden, Andros, Viagra. The innovators, of course, Viagra. Okay? Vardenafil, this Levitra. Yung tadalafil, yung Cialis, actually.
Okay. Ano-anong mga advantages niya at disadvantages?
Well,
what are the effects to the person or the individual using them?
yeah,
May
actually
effect pa rin siguro yan,
meron silang kanya-kanyang strengths.
Okay,
Tsaka
strength.
kanya-kanyang weaknesses, no? Ang isang advantage sa tadalafil, it has a longer half-life, 17 hours. Mas matagal siya actually sa system ng isang patient na nag-take niyan. Okay? Maraming side effect, pero they are favorable.
Yes.
I mean, tolerable.
Yes.
Flashing is one of them. Headache.
Flashing, yung, what do you mean?
Flashing,
Namumula.
you would experience parang namumula yung tenga mo, mainit yung mukha mo, namumula and all that.
Parang babae lang nagpa-flashing, gano'n.
And nasal congestion actually.
Nasal congestion.
Kasi vasodilatory effect yan. Vasodilation, congestion. Tapos siguro ang pinaka-importante pag-uusapan natin, Sir Sunny, is yung absolute contraindication. Kung sino yung hindi dapat mag-take.
Sinong hindi dapat mag-take yan, Doc?
People who are taking in nitrates.
Okay.
What are these? Di ba ho, Sir Sunny, may mga karamihan. Doc, nag-i-Imdur ako. Imdur, it's commercial name. Isordil, isosorbide dinitrate,
Pang ano yung mga yan?
isosorbide 5-mononitrate, those are medications for the heart. Actually, maraming nagtitik sa kababayan na sa mga patient natin na Pilipino para hindi sila maka-experience ng myocardial infarction or yung stroke. Hindi sila dapat mag-take nito.
Hindi pwedeng paghalo yan.
Yes. In case, Sir Sunny, a patient take in. Tapos, in the middle of intercourse, nagkaroon siya ng chest pain, he should rush
Go
to
the
the hospital
doctor.
emergency room
Okay.
and inform the personnel that he took
Medicines.
these medications. You know why? Because hindi sila pwedeng bigyan ng Isordil or Isoket. These are medications for emergency medication for the heart.
For the heart, okay.
Within 24 hours. Hindi sila pwedeng bigyan ng ganyan.
Okay.
That's why ito po yung kailangan yung isaulo na once na naka-experience kayo ng mga chest pains, if you took in these medications, you should bear in mind, pag nag-chest pain kayo, punta sa emergency room. Pag nasa emergency room ho kayo, inform this personnel, these doctors and nurses, that you took in these medications so that they wouldn't give you Imdur or these drugs, these nitrates, na emergency for the heart.
So you get to tell them also, wag mahihiyang, ano, di ba?
Actually, yun yung unang tinatanong sa kanya before I prescribe them, yung drugs na tinitake ko.
Okay. So ito hindi dapat nagkakahalo, sabi mo.
That is the absolute
Is
contraindication.
there a certain time, kunwari, you took it several hours already, how long yung bang epekto ng gamot?
Yes, like I've said, yung tadalafil, it works on a longer period. Okay, but they have equal effect actually. They have equal effect. Yung degree lang ng side effects nila yun.
Oh, okay. So, itong mga pinag-uusapan natin ito, Doc. Yun nga, yung in-advise mo, if you encounter this difficulty, chest pain, sabi mo, diretso sa hospital, you got to talk to yung doktor doon mismo, sabihin mo na kagad. Yun ba sinasabi mo kanina, di ba?
Yeah.
So how will they do this naman? Kung ganyan, merong mga contraindications, ano bang pwedeng, sa mga nagtitake ng drugs na sinasabi mong bawal, ihalo doon, anong pwede nilang i-take para yung kanilang dysfunction naman ay...
Well, actually, if you're taking nitrates, there's no way for you to
Wala talaga.
to take these medications. It would give you harm than good actually.
Okay.
Imbes na ano lang yung
Makatulong.
mo,
Perwisyo.
peperwisyo ka pa.
So it's your life that's at risk here.
Yes.
Hindi lang yung sex life mo.
Yeah.
So you would advise that rather than risking your life, yung sex life mo na muna ang sakripisyo.
Sakripisyo.
Ganyan. Okay.
Tsaka, Sir Sunny, remember, maraming nagmamahal sa atin.
Oo, tama.
Mahalaga yung buhay.
Okay, tama. So ano pa, Doc, ang pwedeng gawin ng isang merong karamdaman na ganito?
Actually,
Sa diet ba? May ano?
Actually, before I forget, is yung if you are taking antibiotics like erythromycin, clarithromycin, and ketoconazole, ina-adjust mo yung dosing ng mga drugs na to. As well as rifampicin at saka phenobarbital.
Okay.
Ina-adjust mo. If you take in rifampicin, medyo higher dose ka. If you taking in erythromycin naman, clarithromycin dapat mababa yung dose.
Sa ano yan? Sa pag-mimix ng mga drugs na sinabi mo? For
Let's say you are on the antibiotics,
Oo.
erythromycin, clarithromycin, dapat ina-adjust mo yung dose mo.
Okay.
Siguro,
Meaning, what do you mean? Adjust yung pataas, pababa, or what?
pag erythromycin, actually, kami naman yung mag-a-adjust niya.
Kayo na mag-aaral.
The most important is, siguro ang patient, when they go to the doctor, they have to tell them what they are taking in. And siguro, siyempre, obligasyon naman ng doktor na kailangan tanungin niya.
Tama.
Kasi kung pag di niya tinanong, di naman alam
Importante
ng patient.
yan yung patient at saka doctor relationship,
Yes,
di ba?
very important. Yung rapport nila, it's
Rapport,
very important.
pag-uusapan, yung talagang, they trust each other.
Yeah.
Okay. So ano pa, Doc? Ano pa yung, sa dieta naman,
Well,
kasi meron certain foods, sabi nila, it's good for sex, sabi nila, makakatulong.
yung mga
mga
aphrodisiac na
aphrodisiac.
sinasabi
Oh.
nila, no? Well, siguro the bottom line here, Sir Sunny, no, if you have sex, you would lose a lot of energy, you would consume a lot of energy. So it's well-balanced diet pa rin.
High protein.
Actually, high protein, yes. There are certain people na hindi bawal sa kanila yung high protein. Okay? May certain people na bawal sa kanilang high carbohydrates. Well-balanced diet pa rin, ideal sa isang tao.
Yung balance talaga.
Balance talaga.
Importante.
And I would like to emphasize to our televiewers yung exercise, Sir Sunny. Okay?
Importante.
Napaka-importante niyan. Exercise, running. May nag-conduct na study about running, these runners.
Yes.
I don't say this because I'm a runner, Sir Sunny, no?
Oo.
But nag-conduct sila ng study among runners. The incidence po ng erectile dysfunction among runners
It's almost nil.
almost nil.
Okay, that's nice. Ayan, yung mga runner. Kaya pala usong-uso yung running ngayon, no?
Yes.
Kahit nasisira na yung mga tuhod at saka yung ankles.
Actually, if you run on the proper way of running, walang injury mangyayari.
Walang injury.
Well, of course, as long as you don't overtrain yourself.
Okay. That's also a problem, no?
Yes. Minsan pag-usapan natin yung running.
Okay, sige. We will do that, Doc, because that's
And
very
we can also teach our running enthusiasts there how to run, yung
Right.
proper
The proper way
posture.
of running, no?
Yes.
Going on, no? We'll just have another break, no? This is
Okay.
a very interesting topic, very, very important po na nakikinig po, lalo-lalo yung kalalakihan. Pero siguro rin ho, maganda na nakikinig din yung misis o yung girlfriend para nang sa gayon, na pag-uusapan nilang pareho, di ba?
That's true. That's true. Hindi lang naman kasi yung male patient ang involved dito.
Na mo problema,
It is also the concern of the partner.
It's a mutual problem
Mutual
for
problem,
both partners, for the partners. Okay, ladies and gentlemen, we're going to have another short break, and after the break, we will continue with our discussion po, mga kaibigan. I don't know if we still have time for yung isang topic natin, no? Yung premature ejaculation. Pero parang ganito na rin yun, di ba? Magka-related ito, di ba? Related subject matter. So, we'll be back, ladies and gentlemen.